Hi, in the next few minutes, I'll provide a brief overview of chronic diseases. By the end of this module, you'll be able to explain what a chronic disease is, list and discuss at least two characteristics of chronic diseases, list at least two types of chronic diseases, explain what a risk factor is, list and explain at least two chronic disease risk factors, and discuss how to prevent chronic diseases. To achieve these objectives, we'll focus on these areas. What is a chronic disease? Chronic disease facts. Characteristics of chronic diseases. Types of chronic diseases. Risk factors. Types of chronic disease risk factors and chronic disease prevention. Chronic diseases may be defined as a group of health conditions or diseases that are long-lasting and require long-term management and lifetime treatment and care. Some facts about chronic diseases. These diseases occur globally and account for about 60% of deaths worldwide. They affect adults and children alike. According to the World Health Organization, about 22 million children under the age of 5 are overweight. By way of characteristics, chronic diseases are long-term conditions that develop over time. They cannot be prevented with a vaccine, and as mentioned earlier, require long-term treatment, care, and management. There are many types of chronic diseases, including heart failure, which is the inability of the heart to effectively pump blood, Crohn's disease, which is the inflammation of the bowel, and multiple sclerosis, which is a condition in which the body's immune system eats away at the protective covering of nerves. The agents that cause chronic diseases are referred to as risk factors. Risk factors are conditions that predispose people to disease. Risk factors that predispose people to chronic diseases may be non-modifiable or modifiable. Let's take a brief look at each one of these types of risk factors. Non-modifiable risk factors are those conditions that cause disease but cannot be changed. For example, age is a risk factor for certain chronic conditions, but one cannot do anything about it. With regards to race, some diseases in the United States occur among certain racial groups than in others. For example, cystic fibrosis is known to commonly occur among people of European descent, while sickle cell disease occurs mostly among people of African and Mediterranean descent. Modifiable risk factors, on the other hand, are those conditions that cause disease, but which can be changed, such as smoking, alcohol abuse, and physical inactivity. Since chronic diseases cannot be cured, the best way to handle them is to prevent them from happening. This can be done by eating healthy food, staying physically active, avoiding tobacco use, and reducing excessive drinking. Thank you. Here are some references for further reading.